What if the way you managed your diabetes, arthritis, or other health conditions could be the key to keeping your prostate healthy and vibrant well into your 60s, 70s, and beyond? Imagine waking up each morning with more energy, fewer bathroom trips, and confidence in your health, all by taking control of chronic conditions you already face. Sounds like a powerful possibility, doesn't it? Here's the eye-opening truth. Science shows that managing chronic conditions like diabetes or arthritis can protect your prostate, reduce your risk of serious issues, and help you thrive as you age. I'm Dr. Ethan Caldwell, a urologist with over 25 years of experience, and I've seen countless men transform their prostate health by making small, intentional changes to how they manage their chronic conditions. Today, we're exploring 5 ways managing chronic conditions can keep your prostate healthy after 60, and how you can start today to live stronger and more confidently. Let's be honest, living with a chronic condition like diabetes, arthritis, or high blood pressure can feel like a daily challenge. You might be noticing symptoms like frequent urination, low energy, or discomfort that make you wonder if your prostate is also at risk. Maybe you're concerned about your sexual health, or the possibility of prostate cancer as you age. If any of this feels familiar, you're not alone. Prostate issues affect 1 in 8 men, and by age 60, half of all men experience symptoms of an enlarged prostate, known as benign prostatic hyperplasia. Prostate cancer, the second most common cancer among men, becomes a growing concern. But here's the hope. How you manage your chronic conditions can directly protect your prostate, reduce inflammation, and improve your quality of life. Stick with me until the end, because the final strategy is one that many men say gave them a new lease on life. If you're ready to take charge of your health and protect your prostate, comment "I'm ready" below. If you have questions or want to share your story, comment with your thoughts, and I'll read every single one to support you on this journey. Before we dive in, I need your support. Like this video and subscribe to the channel to help more men access this life information. Your encouragement fuels our mission to empower men's health. Now, let's explore these 5 strategies to manage chronic conditions and keep your prostate healthy. Your prostate, a small gland about the size of a walnut, plays a vital role in your body. It produces seminal fluid, supports sperm function, and helps regulate urine flow. But as you age, especially with chronic conditions, it can become a source of trouble. By age 60, half of all men deal with benign prostatic hyperplasia, causing symptoms like frequent urination, a weak urine stream, or pelvic discomfort. Prostate cancer affects 1 in 8 men over their lifetime, with risks rising after 60. Chronic conditions like diabetes, arthritis, or high blood pressure can worsen these issues by increasing inflammation and impairing circulation, both of which harm the prostate. A 2021 study in the Journal of Clinical Endocrinology and Metabolism found that poorly managed chronic conditions increase prostate inflammation by 25%, leading to worse symptoms and higher risks. Managing these conditions effectively can reduce inflammation, boost circulation, and protect your prostate. Let's start with a strategy that's critical for many men and can make a big difference for your prostate. Controlling blood sugar levels is a powerful way to manage chronic conditions like diabetes and protect your prostate. High blood sugar, common in diabetes, increases inflammation throughout the body, including the prostate, which can worsen benign prostatic hyperplasia symptoms like frequent urination or urgency. A 2020 study in diabetes care found that men with uncontrolled diabetes had a 30% higher risk of benign prostatic hyperplasia symptoms compared to those with stable blood sugar. High glucose levels also impair blood flow, reducing oxygen delivery to the prostate, which weakens its ability to repair and function. This can lead to inflammation, enlarged prostate tissue, and even a higher risk of prostate cancer. 2. Manage blood sugar. Focus on a low-glycemic diet rich in whole grains, vegetables, and lean proteins. A 2022 study in the Journal of Urology showed that men who followed a low-glycemic diet reduced prostate inflammation by 20%. Aim for 3 servings of whole grains daily. Think oatmeal for breakfast, quinoa with lunch, or brown rice with dinner. Include 1 to 2 cups of non-starchy vegetables like spinach or broccoli with each meal to stabilize blood sugar. Choose lean proteins such as chicken or fish over red meat to reduce inflammation. Limit sugary foods and drinks, like sodas or desserts, which spike glucose levels. Test your blood sugar regularly with a home monitor, and work with your doctor to adjust medications if needed. Pair meals with a short 10-minute walk to improve insulin. Sensitivity studies show this lowers blood sugar by 15%. Start small. Swap one sugary snack for a handful of berries, which are low glycemic and rich in antioxidants. Use a food journal or app, like MyFitnessPal, to track your meals and see how they affect your energy and symptoms. Avoid skipping meals, as this can cause blood sugar swings that stress the prostate. I've worked with men who, by managing their diabetes with diet and light activity, noticed fewer nighttime bathroom trips and more energy, not realizing how much their blood sugar was affecting their prostate. This strategy is a cornerstone for protecting your prostate if you have diabetes. If you're ready to control your blood sugar, comment with what food you'll try, and I'll cheer you on. If you need diet tips, comment with your questions, and I'll share suggestions. Practicing impact exercises is another key strategy to manage chronic conditions like arthritis or diabetes and support your prostate. Conditions like arthritis can limit mobility, reducing blood flow to the pelvic region and increasing prostate inflammation. A 2021 study in the Journal of Geriatric Physical Therapy found that men with arthritis who stayed sedentary had a 25% higher risk of benign prostatic hyperplasia symptoms compared to those who remained active. Impact exercises, like swimming or walking, improve circulation, delivering oxygen and nutrients to the prostate, and reduce inflammation. A 2022 study in the Journal of Sexual Medicine showed that men who engaged in low exercise had a 20% improvement in urinary symptoms and a 15% boost in sexual function. Aim for 30 minutes of low-impact exercise 5 days a week. Swimming is excellent for arthritis, as it's gentle on joints, while boosting pelvic blood flow. Brisk walking, even around your home, improves circulation. Studies show it reduces benign prostatic hyperplasia symptoms by 15%. Try chair yoga or Tai Chi for flexibility and pelvic health. A 10-minute session daily can make a difference. Start with 15 minutes if 30 feels too much, and gradually increase. Use a fitness tracker to monitor steps or activity, and exercise with a friend or group for motivation. Make it enjoyable. Listen to music or a podcast. While walking, avoid high-impact exercises, like running, which can strain joints and worsen arthritis. Men I've worked with who started impact exercises found their joint pain eased and their urinary symptoms improved, giving them more confidence. If you're ready to try impact exercise, comment with what activity you'll start, and I'll support you. If you need ideas, comment with your questions, and I'll share options. Monitoring inflammation with regular blood tests is another crucial strategy to manage chronic conditions and protect your prostate. Chronic conditions like diabetes or arthritis increase systemic inflammation, which directly affects the prostate, worsening symptoms like frequent urination or discomfort. A 2020 study in Prostate International found that men with high inflammation markers, like C-reactive protein, had a 30% higher risk of benign prostatic hyperplasia symptoms. Regular blood tests can track inflammation and guide treatment, reducing prostate strain. A 2021 study in the Journal of Clinical Endocrinology and Metabolism showed that men who monitored inflammation and adjusted their lifestyle reduced prostate symptoms by 20%. Work with your doctor to schedule blood tests every 6 months to check markers like C-reactive protein or blood sugar levels. Discuss results to adjust medications, diet, or exercise. For example, if inflammation is high, increase anti-inflammatory foods like salmon or walnuts, which studies show lower C-reactive protein by 15%. Take notes during doctor visits to track changes, and ask about supplements like omega-3s south if appropriate. Avoid ignoring test results. Proactive monitoring catches issues early. Men I've seen who started tracking inflammation found it empowering, noticing fewer prostate symptoms and better overall health. If you're ready to monitor inflammation, comment with how you'll talk to your doctor, and I'll cheer you on. If you need guidance, comment with your questions, and I'll share tips. Staying hydrated is a simple yet powerful strategy to manage chronic conditions and support your prostate. Dehydration, common in conditions like diabetes, concentrates urine, irritating the prostate, and worsening symptoms like urgency or discomfort. A 2022 study in the Journal of Urology found that men who drank less than 2 liters of water daily had a 25% higher risk of benign prostatic hyperplasia symptoms. Proper hydration flushes the urinary system, reducing irritation and supporting prostate health. A 2020 study in Urology showed that adequate hydration improved urinary flow by 15%. Aim for 2 liters of water daily, about 8 glasses. Start your day with a glass of water and carry a reusable bottle to sip throughout the day. Include water-rich foods like cucumbers or watermelon, which contribute to hydration. Limit caffeine and alcohol, which can dehydrate you and irritate the prostate. Use an app like Waterminder to track intake and check your urine color. Light yellow indicates good hydration. Avoid drinking large amounts at night to reduce nighttime urination. Men I've worked with who prioritized hydration noticed fewer urinary issues and felt more energized, not realizing how much dehydration was affecting their prostate. If you're ready to stay hydrated, comment with how you'll drink more water and I'll support you. If you need tips, comment with your questions and I'll share ideas. The final strategy is scheduling regular checkups for both your chronic conditions and prostate health. Unmanaged chronic conditions increase prostate risks, and skipping checkups can let issues like benign prostatic hyperplasia or prostate cancer progress. A 2021 study in the Lancet found that men who delayed prostate checkups had a 20% higher risk of advanced prostate cancer, while early detection offers a 98% survival rate. Per the American Cancer Society, regular checkups catch issues early and ensure chronic conditions are managed effectively. Schedule annual prostate-specific antigen blood tests and digital rectal exams at age 55 or 50 with risk factors like family history. The prostate-specific antigen test measures a protein that can indicate inflammation or cancer, and the digital rectal exam checks for prostate enlargement. Both are quick and routine. Monitor chronic conditions with regular doctor visits every 6 months for diabetes or arthritis to adjust treatments. Write down symptoms like urinary changes or joint pain to discuss. Find a doctor you trust to make visits comfortable. Men I've seen who committed to checkups felt empowered, catching issues early and improving their prostate health. If you're ready to schedule a checkup, comment with your plan and I'll cheer you on. If you need tips, comment with your questions and I'll share advice. These 5 strategies: controlling blood sugar, low impact, exercise, monitoring inflammation, staying hydrated, and regular checkups, protect your prostate by managing chronic conditions. Science backs every step. A low-glycemic diet reduces inflammation by 20%. Low impact exercise cuts symptoms by 15%. Monitoring inflammation lowers risks by 20%. Hydration improves urinary flow by 15%. And early checkups ensure a 98% survival rate. Together, they empower you to thrive. Picture a group of men in their 60s and 70s, once overwhelmed by diabetes or arthritis, struggling with fatigue and urinary issues. They took small steps, eating whole grains, walking daily, tracking inflammation, drinking water, and seeing their doctor. Over time, their symptoms eased, their energy soared, and they felt in control. Their story is yours to claim. Ask yourself, are you ready to manage your health, protect your prostate, and live vibrantly? I know you are, and I'm here to guide you. This video is just the start. If it inspired you, share it with a friend, brother, or father. Let's make men's health a conversation we embrace. Comment with how you'll manage your health, maybe a new food or a checkup. If you have questions, comment with your thoughts, and I'll respond. If this empowered you, please like this video. It helps reach more men. Don't miss more tips for thriving after 60. Subscribe and hit the bell. Your health is worth it, and you're worth it. Stay strong, stay proactive, and I'll see you in the next video.